everybody. Sabonani Ndani. Siyaphila sibona la namhlanje. Are we here? All right. Sizomuva quick with our program. Today is a very special day for Tina Latanadani Nimikan. Today, today we've got our Deputy Minister of Social Development in the house that is here, Ume Henrietta Okofana. We've also got our Executive Mayor, Councillor Bongani Maloli, that is present.
Thank you all. I think to bring up and to bless this occasion for now and forever.
Today is a happy occasion. Sijabulile kakhulu namhlanje. Bengicela ukuphakamisa uDeputy Minister Bokopani Zulu so we can give a very warm welcome to this man. Ayo, mafiki. Niko pamoja. Deputy Minister, you are starting to commune with me with three things. I'm very jealous.
That's in closing. One of the biggest things it's screening for different types of cancers. So let's go can you go and teach others what you're going to be taught today? Because as South Africans, particularly black communities, we still don't have a good understanding. We still say so having to go and give others information, because it's very important that must participate in so let's make it everyone's business to educate the other person about cancer.
Today it's our community outreach program to Midvaal local municipality. We are celebrating Social Development Month. We are spreading the message, early detection saves lives. We also making sure that because we are in partnership with Heineken to promote the zero product that will enable us to actually minimize a lot of our social ills. We chose Sidibem because they've got a plant here, and we wanted first and foremost for their own workers and their own communities and their own beneficiaries to actually know that there is this product, which is very important to social development, because then it will reduce a lot of our social ills.
As social development, we are the custodians of community profiling. We do community and household profiling. So we have the database. Now, I said to you, we're fighting the social structural drivers. And we're doing this in the name of prevention. Now I know a lot of us are going to say, yeah, but social development and Heineken, where do these two meet? Let me explain the relationship. As social development, we also the department that is responsible for harm reduction. We are the leaders we are the lead department in alcohol and substance abuse prevention, rehabilitation, and treatment. So when people go and get drunk every day, they become our problem. Because we must make sure support groups are there, that AA is functional, registered, that there is progress. So, let's becomes our problem. Because that Sidagwa buys Heineken with all his money while the children are hungry. Again, the mothers get our grant and they buy Heineken while the children have no shoes.
And we are in partnership with PinkDrive to provide the communities free mammograph, free pap smears, free sauna for pregnant women. We are with SASA to make sure that all our challenges on social grant are resolved, but also we've got our mobile ECD to make sure that women can freely participate, knowing where their children are. They can wait for a memo while the child is looked after. So we've got NDA with all our services where the cooperatives can benefit, ask questions, book to be trained, but also where we look after our children through our mobile ECT. The reason why, as I said, Mid-Valley is an important municipality because they're mainly rural, but they also like in Gauteng, so they like far but yet near, and communities like those end up not benefiting from these services because we either go very deep rural or we go very urban or we go to the townships. So as a result, municipalities like this one don't really benefit because they are in Gauteng but rural. So I try to make sure that the communities that fall in the cracks are the ones that are given priority. And we spread in the message, as we said, it's about strengthening families, it's about building caring communities, and it's about spreading prevention, 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 prevention.
When I was in Ustadi, so when I was 36, we found a lump in my breast. And now I'm 62. Early detection saves lives. And we are seeing women younger and younger with breast cancer. So whether you're a man, a woman, a girl child, we all have breasts in our lives. We start off with a breast in our mouths. Were you breastfed? Very good. Breast is sort of what we make us feel we women, or we are told. But we are very scared what will we find. So the big truck is there, it's very pink. I'm on it, I'm hoping to see all of you. We need to check breasts, but there's something else. We need to go down here. And what is down here?
Cancer is one of the biggest contributors to disability. Because when you lose a particular part of your body that used to function in a particular way, it makes you be able to not function. But also cancer is amongst the biggest contributors to gender-based violence, which is a challenge for us today. Because when the breasts, when you have cervical cancer, when the man has prostate and testicular cancer, the argument ensued, and that is where we are. So cancer is a contributor to the social structural drivers that causes gender-based violence. So we're providing these services also to try and mitigate gender-based violence because cancer contributes, especially the 4 cancers: breast, testicular, prostate, and cervical cancer. They are amongst the biggest contributors to gender-based violence. And early detection, as we bring these services, we want communities, we want to build families. But we're not only doing that, we're also making sure that as we do the pap smear, we've partnered with Lancet Laboratories so that we can spread the message, early detection. Within 4 days, we need to know whether this woman has cervical cancer or not, but also we prioritize. As we do the outreach, for any referral from the outreach, we've got an MOU with military 1 and 2 hospitals where we fast track those that we are referring. They go and they get all of what needs to be done at a hospital level, including the operations, for free. So they don't necessarily have to go and queue before the patients, because then the outreach doesn't make sense. So we make sure that we transport them as well. We've got a fleet of 18 Kumbis that we use with PinkDrive that takes our patient, and we make sure as social development that the patient is also accompanied by a family member. A lot of the times people ask us as social development, but this is a health space, why are you in it? Prevention remains the core responsibility of social development. Prevention and support, and prevention, care and support, and health does the treatment. So by the time we need to prevent and we need to educate, and by the time education has not really worked, that is when health steps in. That is where social development is about. Early detection saves lives. Early detection of gender-based violence, early detection of breast cancer, cervical, early detection of any community challenge becomes a very important element, because prevention is a core function for social development. As they would say, you know, it's better than cure.
My sister from another mother, the Deputy Minister of Social Development, for having taken PinkDrive under her wing some 10 years ago when we started. The Deputy Minister has been very instrumental in assisting PinkDrive in raising funds to provide such outreaches far and wide across South Africa. But today, I have to thank Heineken, because if it wasn't for them, we wouldn't be here today to be able to provide the much needed services into this community. To the Mayor of Midvaal and your councillors, thank you for the warm welcome that you have given us. And I'd like to believe that this is only the start to a journey that goes forward. So ladies, I urge you to please go today. You do not have to wait 6 months or 9 months to get your results from the National Health Laboratories.
So further which is the test for HIV and our services. As testing for HIV, because social development, women is prevent HIV. And the CSI must study when the condoms are involved. When we are drunk, we forget the condom. So please,